Hey everyone, and welcome back to the Nachita Bharat YouTube channel. I'm so incredibly thrilled you're joining us today because we've got an explainer that touches on something absolutely vital, yet something that usually gets swept right under the rug. Today, we're going to have a real, crucial conversation about the mind of our nation. We're unpacking India's mental health landscape, from the massive scale of what's really a hidden epidemic to the surprisingly hopeful steps we're taking toward holistic healing.
So let me ask you this. What is the hidden cost of our modern lives? I mean, we see the bustling cities, right? The booming digital economy, the crazy academic achievements. But right beneath that shiny surface of outward success, there's this vast invisible network of internal struggles. And today, we're going to make the invisible completely visible.
Okay, here's our agenda for this explainer. 1. India's silent epidemic. 2. The national cost. 3. Policy and digital reforms. 4. The treatment gap. And finally, 5. A stigma-free future. All right, let's jump right in. Section 1. India's silent epidemic. Understanding the human scale.
Okay, to really wrap our heads around this crisis, we have to grasp the sheer human scale of it. Look at this. According to national studies and World Health Organization estimates, 15% of India's adult population experiences mental health issues that need active intervention. That's over 200 million people. To put that into perspective for you, that is roughly 1 in every 7 people you pass on the street. Literally 1 in 7 people sitting in your office, on your commute, or in your classroom is living with a diagnosable condition, things like depression, anxiety, or substance abuse. It's a massive crisis, just hiding right there in plain sight.
And well, when we look a little closer at the demographics, a pretty heartbreaking pattern emerges. This crisis hits our youth exceptionally hard. Get this, 60% of mental health disorders occur in people under the age of 35. And tragically, suicide is now the leading cause of death for Indians aged 15 to 29. On top of that, research shows that 32% of our college students report moderate to severe depression symptoms. What you really need to take away from this is that the intense academic pressure, the crazy competitive exams like IIT JEE or NEET, parental expectations, and this huge spike in digital addiction are creating an absolute pressure cooker for the younger generation.
Section 2. The national cost, individuals, and the economy. Now, transitioning from the deeply personal impact to the broader national cost, we see a really stark divide based on where people live. The National Mental Health Survey found that in rural areas, the prevalence of mental disorders is around 6.9%. But look at the urban areas. That number basically doubles, jumping up to 13.5%. And it's even higher in the big urban metros. It turns out our modern fast-paced city life, with all its unique stressors, the isolation, the intense economic pressures, it acts like a massive catalyst for mental distress.
And the financial toll of all this distress? It's staggering. We're looking at an estimated economic loss to India of about $1.03 trillion between 2012 and 2030. That is roughly 2.5 lakh crore rupees annually. That massive figure? It represents lost workplace productivity, increased absenteeism, a drop in efficiency, and just the downright heavy cost of leaving these conditions completely untreated. So you see, mental health isn't just a medical issue, it's actually a profound economic one too.
Section 3. Policy and digital reforms. Visualizing the interventions.
Now, what's really interesting about this is that we're pivoting from the problem to the progressive, systemic actions the government is actually taking to fight back. The absolute bedrock of this new approach is the landmark Mental Health Care Act of 2017. This was a huge, historic shift for India. It moved us away from this old custodial approach to one that's completely rooted in human rights. It legally recognizes mental health care as a fundamental right for every single citizen. And crucially, it decriminalizes suicide attempts, meaning people get rehabilitation now instead of punishment. It also restricts therapies like ECT for minors, and it mandates, and this is huge, it mandates that insurance companies cover mental health treatments exactly the same way they cover physical ailments. This lines India right up with UN human rights standards.
So to deliver this care on a massive scale, under the broader National Mental Health Program, the government launched Tele-MANAS back in 2022. And let me tell you, it is a real game changer. It provides free, 24/7 mental health support through a toll-free number, and they do it in 20 different Indian languages. It literally brings immediate telecounseling and psychiatry referrals straight to people's phones, totally bypassing any geographical barriers.
And the utilization of this service? Unbelievable. Since it started, Tele-MANAS has handled over 3.28 million calls. Over 32 lakh, and it's evolving fast. As of October 2024, they actually launched a dedicated mobile app that offers self-care strategies, plus they've expanded video consultation services across several states. It's a massive, massive step toward making healthcare inclusive, affordable, and most importantly for us, stigma-free.
Section 4. The treatment gap. Confronting our systemic hurdles.
Okay, let's move to the next point and see how this builds, because, well, we're due for a massive reality check. We have the progressive laws, we've got the digital hotlines, sure, but despite the profound need, somewhere between 83 and 92% of people with mental disorders in India do not receive proper treatment. Just let that sink in. Only a tiny fraction, like 8 to 17%, are actually getting the help they need. This huge treatment gap exists because of a severe lack of awareness, an intense, persistent social stigma that just forces people to suffer in silence, and, quite frankly, a critical shortage of professionals.
To put those systemic roadblocks into perspective, look at the reality here. Currently, India has only about 0.75 psychiatrists for every 100,000 people. The WHO recommends a minimum of 3. That means for a population of 1.4 billion, we only have around 9,000 psychiatrists. On top of that, mental health receives less than 2% of the total health budget. So these are the severe structural hurdles we're up against: chronic underfunding and massive workforce shortages that absolutely have to be addressed if we're ever going to close that treatment gap.
Section 5. A stigma-free future. The blueprint for tomorrow.
So, how exactly do we overcome these hurdles? Well, by shifting our focus to mobilized hope and real community-centric care. A shining example of this blueprint is India's first national suicide prevention strategy. It uses a multi-sectoral framework called the REDS path, REDS. It focuses on reinforcing leadership, enhancing health service capacity, like actually integrating mental well-being curriculums into our schools, developing community resilience to finally reduce that stigma, and strengthening surveillance. The ultimate actionable goal here is to reduce suicide mortality in the country by 10% by the year 2030.
As the Ministry of Health's strategy so beautifully puts it, the motto is energize to synergize. Look, a mentally healthier India is absolutely vital, right? Both for our individual well-being and for our overall national development. But it's not something doctors and hospitals can just fix on their own. It requires a whole-of-society approach. We need concerted efforts from our schools, our workplaces, local panchayats, the media, and yes, our own families to break the stigma and offer support that actually lasts.
Which leaves us with this final provocative thought. We've got the progressive laws on the books, we have 24/7 digital hotlines literally sitting in our pockets. The infrastructure is growing. But you know what the ultimate barrier is? It's right here in our heads. Are we, as a society, actually ready to change our minds about mental health? Are we ready to rethink our own mindsets, maybe check in on our neighbors, and take active steps toward a truly stigma-free India? I challenge everyone watching Nashida Bharat today to be a part of that change. Thank you so much for joining me for this explainer. Keep learning, keep questioning, and I'll see you next time.